I pull down, that tends to hurt my patients who have swimmer's ear. A classic sign of otitis externa or swimmer's ear that I see in the office when I'm evaluating patients is when I go to get my otoscope to put in their ear to take a look is when I pull on the lower ear, and I often do this to be able to put the speculum in, right? We kind of like to just kind of slide it in there, but we're often pulling down on the earlobe like that to put it in. When I pull down, that tends to hurt my patients who have swimmer's ear. Okay, any manipulation of this ear canal, pushing it, that type of thing, that will hurt them. And furthermore, going ahead and sticking this speculum inside the ear to look in the canal tends to be uncomfortable as well. Why? It's because that ear canal is swollen, it's painful, it's infected, it's edematous, it's red, and often there's like discharge. And take a look at this image here. This is a picture of otitis externa or swimmer's ear. Often this sort of whitest discharge, it can be other colors too, right? I mean, that can be all sorts of things, but that discharge is often what we see. It's very classic for swimmer's ear. And yes, it can be very, very painful for people. Those are many of the signs and symptoms of swimmer's ear. So also people can get discharge or drainage from the ear. It can kind of leak. It can be foul smelling. The ear can also be kind of itchier, like irritated. The pain, absolutely. There can also be hearing loss. You can imagine that if you've got all this gunk in your ear and it's swollen and all that kind of stuff, you may not be able to hear as well. Guys, I'm Dr. Jen Cottle. It's good to see you. We're talking about swimmer's ear or otitis externa. So otitis externa and swimmer's ear, it's the same thing, okay, just different names. Otitis externa is like the medical name. What that means, it's an outer ear infection in the canal. Like basically, if you stick your finger in your ear, that canal area, that's where the infection is. How that is different from like your run-of-the-mill ear infection, where we often see people for. The ear infections that we're talking about there are in the middle ear. So they're further inside, basically inside your, like you go in like that. Okay, they're deeper, basically. It's not just outside where you stick your finger in. But the swimmer's ear is where you stick your finger in, okay? Now, why do we call it swimmer's ear? Okay, this is really important. And by the way, swimmer's ear does not only happen in people who swim. It can happen in people who wear lots of earbuds or hearing aids, people who use Q-tips or paper clips or bobby pins or anything to sort of scratch or clean their ears. It can happen after you injure your ear canal for whatever reason, or maybe you scratch it. What's the common denominator with all of those situations? The common denominator is that there's some injury or change to the canal. So with swimming, for example, you're probably saying, well, what happens with swimming? Well, with swimming, if you're swimming a lot, that water gets in your ear, and what it does is it sort of disrupts the earwax that is there to protect your canal. It can cause a change in the sort of the bacterial flora there. It can cause some damage to that canal and make it more likely or susceptible for bacteria and things to get in and cause an infection. So that constant swish of water in and out actually can be damaging, predisposing you to get infected and get that swimmer's ear. That's why we call it swimmer's ear. And then the thing is, when you have earbuds in and hearing aids, or you're digging in your ear with stuff, is you can and often damage sort of the lining of the ear canal, the protection that you have. And with that damage can come bacteria to set in and cause an infection. You see how that works? It's another reason why we say no Q-tips should go, nothing smaller than your elbow should go in your ear, no bobby pins, no this and that. And then you have to be careful with things like earbuds and stuff. All right, so now, so what do we do for it? So I'm going to talk to you now about the treatment for it. Okay, we talked about the symptoms. We're going to talk about the treatment for it. And then we're also going to talk about like prevention strategies, okay? So the good thing is, if you have a swimmer's ear, by the way, if it hurts to pull, like you're in a lot of pain, and it's going to be painful, you go see your doctor, go to urgent care, go somewhere and make sure you are seen, okay? And don't be putting anything in your ears until someone takes a look at you. The good thing is we have great treatments for this. Generally, we give antibiotic or antimicrobial or antifungal drops, depending on whatever the bug is that's causing the infection. Sometimes they can be fungal, but we can give you drops, okay, that are medicated to help treat that outer ear infection. Sometimes before we even do that, though, we have to get some of that gunk out of there, which can be really tough. Sometimes I send people to ENT. It's really bad. And every now and then I'll have an ear canal that's like so swollen that I'll have to get, like, this hasn't happened since I was a resident, but I had to get a wick, almost like a candle wick. We have to stick in the ear so that when you put the drops in, it's able to take it into the ear because the ear is so swollen. You know, if you can imagine the ear is so swollen, it's going to be hard for medication to get in there. Anyway, point being is you might have to have some of the gunk removed, but ear drops that are medicated are pretty standard, okay? Sometimes if your infection is really bad enough, we may give you a pill, antibiotic as well, and then pain relievers, Motrin, Tylenol, or whatever your doctor suggested. Of course, I'm not your doctor. Your doctor should be making these suggestions. But this is the thing. The biggest prevention that we have here, and I'm going to link a video here about how to get water out of your ears and how to keep water out of your ears, is we call it swimmer's ear because a lot of times this happens in swimmers. So if you're a swimmer, the biggest thing, and one of the biggest things you can do for prevention is keeping water out of your ear and keeping your ears dry. And let me back up and say, the other part of the treatment, in addition to the antibiotic drops and the pain medications, possible oral, you got to keep those ears dry while you're under treatment. You can't be swimming while you're being treated for a swimmer's ear. Okay, you got to keep it dry. So that may mean once you're doing that, using a shower cap in the shower to keep it dry, obviously no swimming, etc. But back to what I was saying before, prevention from keeping this happening in the first place, there are many different ways you can do techniques to keep your ears dry in the first place and try to keep them dry, keep the water out. I'll link a video here. I said that like a minute ago, but I'm saying it again. I'll link a video here with techniques, especially if you're a swimmer. And then for the rest of you guys, like if you're not a swimmer, just don't be digging in your ears and stuff, and be thoughtful. And if you wear hearing aids and stuff, make sure they're fitted properly and make sure you're getting them checked out and all that good stuff. But guys, I hope this is helpful. This is just a little primer on swimmer's ear. Let me know what you think. Let me know what you do if you've ever had it. Share your experiences, because sometimes what you say actually helps other people. For those of you who don't know me, I'm Dr. Jen Cottle. I'm a practicing family physician. I'm an on-air health expert and video creator. I do videos every single day on different health topics, including things like swimmer's ear and other stuff. So on Facebook, please like and follow my page. For those of you on YouTube, please subscribe to my channel. Click the little bell for updates. Also, I have private subscription groups on YouTube and Facebook. Would love for you to follow them. And then I'm on Instagram, TikTok, and WhatsApp at Dr. Jen Cottle. And I have a free health newsletter at drjencottle.com. You just go to drjencottle.com and you'll check it out. You can check it out, sign up for it. I really hope this is helpful. And yeah, just be aware of the swimmer's ear and kind of pay attention to your kids and all that good stuff. And I don't know, it's just really important. Swimmer's ear can be so painful, like so painful. So this is also a note for parents that, like, if your kid's like, ow, like listen to that, believe that is potentially a thing. But the good thing is, I mentioned, is it is treatable. Guys, I'm Dr. Jen. I hope this was helpful. I love you all. All right, guys. Bye.